My name is Tennille Henry. I will be doing my head-to-toe assessment today for the advanced health assessment class. I will start by doing a survey of my environment. This is my setup for today for my setup of my instruments. Okay, and then I will be introducing you to my patient in a second. Do I have your consent to be videotaped today?
Yes.
Okay. Alrighty. So knock knock.
You can come in.
Okay. Hello there. My name is Tennille. I'll be your nurse practitioner today. Can you please tell me your name, date, and birth?
Wood magnesium.
Okay, we're gonna perform hand hygiene. Okay, Mr. Wood. So I'm gonna go over your vital signs. So your height's 5'10", your weight is 165, you have a healthy BMI at 23.5. The blood pressure was normal. I'm gonna go ahead and remove that blood pressure cuff. And your heart rate was 73, so very good. Your temperature was also 97.8. So what brings you in today?
I'm here for my annual physical.
Very good. Okay, so I just cleaned your hands. Is it okay if I touch you?
Yes.
Okay, so on general appearance, the patient appears well groomed. The patient appears clean. Normal skin tone for his race, African American, and the skin texture is normal, smooth. Is it okay if I touch you? Okay, and your temperature is nice and warm. Okay, so is it okay if I can touch your head? Okay, so we're gonna go ahead, and we did hand hygiene already. I'm gonna go ahead and place some gloves on. Okay. Just in the lights. So we're gonna note his hair for any tenderness. Please tell me if you have any pain. For distribution of hair, distribution is normal. Hair texture is coarse. Hair color is black, and no tenderness noted. Normal on the scalp is dry and intact. No lesions noted. So I'm gonna go ahead and start by palpating his temporal pulses right here. Alright, and after temporal pulses, we're going to go to the trigeminal. Please clench your jaw. Do you feel any pain right there?
No.
Good. You can relax. We're checking for TMJ right there. After we, then we're going to go to cranial nerve number 7. So for cranial nerve number 7, we're going to be going to assess the structures. Please go ahead and smile for me. Good. Relax. Go ahead and puff your cheeks like that. Perfect. And raise your eyebrows. Very good. So that's normal. So now we're going to go to the eyes. So for the eyes, I'm going to have you for optic nerve, cranial nerve number 2 for your optic nerve. Cover your left eye. Okay. Go ahead and read the smallest line that you can see for me.
LTFEH.
Okay. Switch hands. Cover your other eye and read the smallest line that you can read for me.
LTFEH.
Very good. All right. So next we're going to be checking for the oculomotor. That's going to be cranial nerve number 3, oculomotor, trochlear cranial nerve number 4, and abducens. That's cranial nerve number 6. And we're going to be checking for nystagmus as well. So I want you to follow the tip of this pen light without moving your head, only your eyes. Good. Relax. And then we're going to be checking for accommodation here as well. Very good. We're going to be doing the peripheral wiggle test. Go ahead and cover your left eye for me. All right. Tell me when you see it and how many fingers you see. How about now? How about now? Very good. Switch hands. How many fingers do you see? How many fingers do you see? How about now? Very good. Okay, now we're going to be looking at the pupils. We're assessing for pupil size. This would also be cranial nerve number 2, the optic nerve. So go ahead and look straight ahead. And then his pupil size is about 2 bilaterally, potential reactions of both eyes. Keep on looking straight ahead for me. We're looking for, we checked accommodation, we're looking for pupil responses. And then we're going to be pupil responses, pupils equal red and reactive to light. I'm going to go ahead and look at the structures of his eye. We see that his conjunctiva is normal, his sclera is white with blood vessels, moist, very moist. His cornea is round and his iris is brown. So the structures of his eyes are normal. And then his vision was 20/20 from the Snelling chart. Okay, so after we check for the eyes, we're going to go ahead and look at the ears. So at the ears, we're looking for normal ears with no lesions, no ecchymosis, no deformities noted on the ears. So we're going to start off with the whisper test. So tell me the number that I say.
16, 24.
Very good. And then we're going to be doing the, that was the whisper test. We're going to be doing the Ryan and Weber test. So for the Ryan and Weber test, what I'm going to be doing, tell me, is the sound centered in the middle? Very good. That was very good. And now we're going to be doing on your bone. Do you hear that?
Yes.
Okay, is it louder in the air or is it louder now? Okay, very good. So air conduction is greater than bone conduction, so his Ryan test was normal. For his ears, next we'll be using the, we will be doing the red light reflex with the ophthalmoscope first. Okay, look straight ahead for me. Very good. All right, so we'll be doing the otoscope exam, both ears. So I see some minimal cerumen in this ear. I do see the tympanic membrane. Very beautiful. The cone of light is at 5 o'clock, and I can see his middle ear and his auditory canal. Very good. We're going to go ahead and switch ears. So this ear has more cerumen in it. So I'm not able to see the middle ear as well, but I do see a cone of light at 7 o'clock. So this is normal. Very good, and the tympanic membrane is present. Okay, next I'm going to go ahead and assess his nares. So we're going to inspect the nares for patency. His nares do look patent. Okay, and then go ahead and look up for me. I'm checking his nasal mucosa. Very good. Turbinates are normal for the nasal mucosa, and it's moist. Very good. Okay, so we use, do you have any sinuses, any sinus problems? Okay, I'm going to go ahead and palpate. Please tell me if you feel any tenderness.
No.
Okay,
No.
so that was the frontal and maxillary sinuses. So we're looking at the lips. We're noting the lips for the mouth. We're noting for symmetry of the mouth, normal color. So then I would perform hand hygiene, put new gloves on for the mouth. I'm going to use my pen light, so go ahead and say off for me. Open your mouth. Okay, so we're looking at the hard palate, we're looking at the pharynx, it's pink, it's moist, his teeth are intact. We're looking at the tongue, we're also looking at the uvula. Say ah. Very good. We're assessing for the, say ah again for me. We're assessing for the gag reflex. Okay, very good. We're assessing for the uvula midline. Tonsils are very small, but they are there. And then the pharynx, there's no exudates or lesions on the pharynx. The hard palate is normal. And the tongue, we're assessing for fat facilitation of the tongue and for symmetry. Everything looks normal. It is pink, it is midline, and mouth is normal. And then go ahead and swallow some water for me. Okay, go ahead and open. Okay, and then uvula is still midline. Okay, so while I'm here, I'm gonna go ahead and palpate his thyroid gland. We're looking for any enlargements or nodules of the thyroid. So there's no enlargement or tenderness. Is that tender? Very good. So his thyroid is midline. So his trachea, so that's normal. And then we're gonna go down to the neck. So we're gonna be checking for the lymph nodes up the neck. So we're gonna be doing, can you turn your head this way for me? Pre-arcular, post-arcular. We're palpating the lymph nodes. Occipital, tell me if you feel any tenderness. I'm feeling for any enlargements. Okay, tonsillar lymph nodes. Submandibular, submental. Superficial cervical, and posterior cervical. Very good. And then supraclavicular lymph nodes not enlarged. Okay, so his neck is normal, his mouth is normal, his skin was normal, his eyes, we did ears, we did mouth, we did neck. So then we will be doing his shoulders. Okay, so what we're going to be doing is assessing his shoulders. Can you go ahead and remove your shirt for me, please? Okay, all right, so for your shoulders, you can go ahead and remove that shirt as well, please. We're going to assess his subacromial, acromyoclavicular joint, and then his sternoclavicular right here. Okay, we're noting for any tenderness. And then we will be doing, I'm going to have his raise both arms, lift both arms for me. We're palpating his axillary lymph node, or axillary, central. We're looking for any enlargements, pectoral, subscapular, and lateral lymph nodes. Okay, go ahead and put your arms down for me. We're assessing also for cranial nerve, number 12, the spinal accessory. Go ahead and shrug against me. Very good. Shoulders are strong. Go ahead and rotate your shoulders. We're looking for internal rotations. Any difficulties? Rotate your shoulders backwards. Very good. Relax. And I'm going to have him extend this shoulder, extend that shoulder. No limitations, ease of movement. And for the neck, I'm going to have him rotate his neck forward, backwards, to this side, and rotate your neck for any limitations. No limitations noted. So then for the arms, we're going to be palpating his elbows for any tenderness. We're also going to be looking at the epitrochlear nodes to see if they're inflamed. We check for shoulder range of motion. Now we're going to be checking for elbow range of motion. Okay, and then we're going to go ahead and rotate your arms inwards and rotate your arms outwards. Very good. So normal. All right. Go ahead and relax. We're going to be palpating his radial arteries bilaterally and his brachial arteries bilaterally. So the amplitude and strength are very good. Okay, next I want you to squeeze my hands as tight as you can, but not too tight, tight. We're just checking for physical strength. Physical strength is 5 out of 5. Okay, we're just going to take a look at the chest now to make sure the chest is symmetrical. So right now we're going to go ahead and switch chairs so that way it's easier to see. Can you go ahead and sit here for me, please? Thank you. All right. So right now I'm looking for ease of breathing, for symmetry, and for the AP diameter. His AP diameter is normal. So the anterior chest, we're looking at the clavicles. I'm going to ask him to take a deep breath in and out through his nose. We're going to be listening for bronchial, vesicular, and vesicular lung sounds. Okay. Deep breath in, out. 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 And vesiculars at the bases. Deep breath in, out. Deep breath in, out. Very good. Okay, so then We're also going to be going ahead and listening to his, we're going to be going ahead and palpating his carotid arteries. We're feeling, palpating for the strength and amplitude of his pulses. He's +2, very normal, +2, and I'm going to be listening for bruise at the carotid arteries as well. Oh, hold your breath. Okay, breathe. Hold your breath. Very good, no bruise present. While I'm on the arteries, I'm going to go ahead and listen to his aortic artery, second intercostal space, right external border. Then we're going to be going to the pulmonic, second intercostal space, left external border. Erb's point, third intercostal space, tricuspid, fourth intercostal space, and mitral, also known as point of maximal impulse. Very good. Heart rate is normal and rhythm is normal. Next we're going to be doing is percussing for tactile remedies on his posterior chest, listening for his lung sounds. So say 99 for me.
99.
Say 99.
99.
Very good. Okay, so next we're going to be percussing his posterior lung sounds as well. Just breathe normal for me. And we're listening for a resonance sound. Okay, then I'm going to auscultate his posterior lung sounds as well. I'm going to ask you to take a deep breath in and out through your nose. Deep breath in, out. 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 Very good. And we checked for the egophony and bronchophony already. So we're going to be checking for CVA tenderness while I'm on his posterior. Can you turn to the side for me? Okay. Alrighty. So we're just going to, okay, lean forward. Alright. Please let me know if you feel any tenderness. Any tenderness? Very good. And while he's bending, I'm also looking at the midline of his spine. Spinal midline. And he's able to bend his hips. So that's very good. Okay, alrighty. So what I want you to do next, we're gonna go ahead and get you back to this chair. Very good. Okay, so next we're gonna be doing the abdominal. Okay, very good. So I'm looking at that for the abdomen. I'm looking for any scars, striae, pulsations, contour, anything abnormal. So we're gonna go ahead and have the patient relax and lay back. So on inspection, his abdomen is normal. So I'm going to go ahead and auscultate his abdomen at the 4 quadrants. Very good. We're also going to be listening to the bruise for the abdominal aorta, renal, iliac, and then femoral. Okay, femoral arteries, that's normal. Next we're going to go ahead and percuss. So we heard resonance on the posterior chest. We're listening for a tympanic on the 4 quadrants. Very good. And then we're going to percuss the liver on the right side. We're percussing. We want to feel a dull sound, and then we're going to palpate for the liver edge. It's not enlarged. On the left border, we're going to palpate for the spleen. It's not enlarged either, and we're going to percuss the spleen as well. And while we're on his abdomen, we're going to go ahead and percuss his bladder as well. And we check for CVA tenderness, which was negative. Okay, and we check for the abdominal bruise. So while I'm here, I'm going to have the patient roll up his pants. Normally patients would be in a gown. Okay, so I'm gonna be looking for his, we did genitourinary, his hips, right? So we would be looking for any tenderness. We're feeling for the anterior iliac spine and the greater trochanter. Does that hurt? Does this hurt?
No.
Okay, we're gonna be looking for hip range of motion. Okay, go ahead and relax for me. Okay. Any tenderness?
No.
Okay, and we're gonna be checking for the so sign. For the so sign, please tell me you feel any pain.
No.
Very good. Alrighty. How about now? That was the obturator sign. Okay, very good. So hip strength is normal. Next we're gonna be checking for any swelling at the knees, at the patellar. So we don't feel any swelling. No swelling at the knees. No swelling at the feet either, and no swelling at the ankles. Very good. So we're gonna check for knee range of motion with flexion, extension, internal rotation bilaterally, flexion, extension, internal rotation bilaterally. So knees and hips noted to be normal. And we're gonna go ahead and feel for the popliteal pulses on both sides. The dorsalis pedis pulses, very good, nice and strong, +2, and the posterior tibial pulses, okay, very good, no swelling or edema on the ankles or the feet. Next we're going to check for the ACL, the anterior drawer movement, okay, we're going to check if there's any retractions, normal, okay, normal, okay, very good. Alrighty, so next we're going to check for rapid alternating movement test. Go ahead and then flip your hands back and forth quickly. Okay, and then look at your thumb, and then connect it to your pinky finger, your index finger, and your middle finger, and do it quickly back and forth. So rapid alternating movement, normal for upper extremities. Then for his lower extremities, I'm going to have him tap my hands. Go ahead and tap my hands repeatedly. And then for the lower extremities, normal. Okay, and then we're going to check the strength of his ankles. So we're going to have him rotate plantar flexion, dorsiflexion. And while we're here, we're just going to go ahead and check for the Babinski reflex. With this, okay, very good. Very good. All right, so then we're going to check for the deep tendon reflexes. Okay, so the biceps is going to be C6. Okay. Triceps C7. Relax. Very good. And then the brachioradialis. Very good. Then we're going to be doing the patellar as well. Go ahead and put your knee at a 90-degree angle for me, please. That's L2, L3, L4, other. Very good. And then we're going to be doing the Achilles as well. Very good. So his deep tendon reflexes were normal. We did Babinski. Go ahead and stand up for me, please. What I want you to do is stand right here, and then go ahead and walk for me. Walk your normal distance. Normal walking. Okay, turn around. We're going to do heel to toe. So walk one heel in front of the other, please. Okay, very good. You can stop. Go ahead and stand there and close your eyes. We're checking for the Romberg test. We're checking for any drips. Okay, go ahead and open your eyes. Raise your hands. We're going to check that for 30 seconds. For the Romberg test to see if the patient drifts. That's normal. Open your eyes. And sense of direction is still forward. Very good. Okay, go ahead and push against me. Okay, upper body strength is normal. Go ahead and lift your legs. Lower body strength is normal as well. So patient did well on his complete physical exam. Capillary refills were normal. Physical strength is normal. So Mr. Woody, you completed your health physical exam. I will tell you to go and see your ophthalmologist once a year. I would recommend that. Even though your eyesight was 20/20, it's good to see normal structures of the eye each year, especially because of your family history that we discussed. And then please come again in 1 year, okay? Thank you.